Okay. Good morning, everyone. Thank you for joining us at Focus on Policy with Focus St. Louis. I'm Dr. Wally Seaworth, the Director of Civic Engagement for Focus St. Louis. Glad you're here, and I have some fantastic guests with me today that are on the front lines of both the advocacy and the policy side and the practice side, what people are actually seeing out there in the field as we move forward with this COVID crisis. With me this morning in alphabetical order are Amy Blouin, the CEO and President of the Missouri Budget Project. Welcome, Amy. You can go ahead and unmute yourself. And also Dr. Kendra Holmes, the Chief Operating Officer for Affinia Healthcare. Welcome. May I use Kendra while we're on air here instead of Dr. Holmes? Okay, all right, fantastic, thank you. And Alex, the Director of Government Relations for the Missouri Foundation for Health. Welcome, thank you all for joining us. We are also expecting Mardy Leathers, the Director of Workforce Development for the state, to join us at any moment. But I'm going to go ahead and jump right in and keep us on schedule. Amy, I'm going to start with you. With the Missouri Budget Project, this economic shutdown is obviously having a big impact. Can you give us a 3 to 5 minute kind of cap of what the projections for the Missouri budget look like? How are legislators and the governor responding, and what do those federal dollars mean for us?
Sure. Yeah, thanks for having me, Wally. A couple of things. First of all, most people know this or recognize it, that as unemployment has been skyrocketing in the last couple of weeks as a result of the pandemic, we actually are expecting that to have a severe impact on our state budget. You know, not only do our tax dollars flow because people have incomes, and when those incomes go down, the tax revenues go down. But at the same time, simultaneously, we're looking at a big increase in the number of folks who need services too from the state. So if you can pull up that first slide, I think it'll help folks kind of see the impact that we're looking at. And the Missouri General Revenue Budget is what you're looking at here. It is about $9.5 billion right now. We expect, if we have a situation similar to the Great Recession, you can see that red line means that our tax revenue will decrease by about $2 billion over the next 2 years. That's $900 million from today through next year, followed by another billion or more. And that's what I think that we're probably looking at, is that red line. We did walk this out, the estimates out, to look at both what would happen if we had a situation similar to the Great Recession, which is what I just referred to, versus a situation similar to the economic impact following 9/11. And that's the gray line that folks see. But this is obviously quite dramatic, and folks, we're not alone. Other states are dealing with the same thing. So the Congress has been acting significantly and very quickly to provide funding to the states that would both help to offset the healthcare consequences of the COVID pandemic and the revenue and economic consequences of COVID. And one of the things that they've done is they've allotted about $2.4 billion for Missouri. And that money is being debated this week in Jefferson City.
Okay, so $2.4 billion for Missouri. If that actually looks like it might help, might really kind of close that gap. So that's good news.
It is. It's very good news. The issue is that at the same time, we've got significant increases in what our costs are. So that $2.4 billion needs to be used. A significant portion, probably about half of it, needs to be used to shore up the public health infrastructure. It's going to go directly to localities to help with local public health needs, including, but potentially, creating new hospitals on the side of, hospitals that could be like field hospitals, operate like field hospitals.
So that's the other piece of the puzzle then. That $2 billion can't just cover kind of our normal budget gap. That $2 billion also has to include all of those emergency funds and the costs of COVID itself. So maybe not as rosy as it sounds.
Exactly.
Okay.
And, most states are looking at something similar to the slide that you just pulled up, with significant increases in basic needs, safety net services, which are going to cost the state something. There is additional federal money for Medicaid coming in that's beyond the $2.4 billion. There is some federal money for SNAP, significant federal money, because SNAP is mostly paid by federal funds, and there is more funding coming specific to childcare too. So there is, some of these needs are being met, but our traditional budget infrastructure, everything from K-12 education to higher education to our safety net services to infrastructure needs, all of that will be impacted by the revenue decline.
Okay, thank you for that kind of scary update, Amy. I'm going to go ahead, since we're doing the kind of legislative and policy piece. Alex, I'm going to jump over to you and ask you to go ahead and give us an update on what's happening legislatively. And I know the legislators are back in today, so after you.
Yes, thank you. So we're obviously following the process this week for passing the supplemental budget for fiscal year 2020, which is what we're in right now. And the process that they're trying to do is really accept the federal dollars that are coming down and try to give authority to the administration to spend all of this congressional funding from these separate packages. So yesterday into the evening, the Senate Appropriations Committee worked on the markup of the supplemental budget. And then this morning, the full Senate will vote on that. But then it will also have to be sent back to the House for the House to approve it, because the House back a few weeks ago, they did approve a supplemental budget, but it was very small. It was only, I think, about $40 million. And it was before some of these congressional, the second and third congressional packages had been passed. So they will vote on that later today, most likely, finalizing that hopefully today. I think just to follow up on what Amy mentioned, one of the things that we're really trying to keep track of, especially as we sort of follow the supplemental budget, is how are we going to then distribute some of this funding to local communities and to the providers or the public health sector that's really been the front line in all of this, especially over the last month and a half. And so I know we'll probably get into that throughout the next hour or so, but really that's something that there are still a lot of questions, and it was apparent yesterday during the hearing that there's still a lot of questions about how some of this federal funding will be distributed and used. So we're really kind of eager to see what that guidance looks like so that we can help our communities that are dealing with the crisis.
Thank you. And I'm just going to bring one thing up, because I know this is something both of you have mentioned. Yeah. This need to come back and supplemental budgets because the prior amounts didn't include some more of that federal money coming, could have easily been solved by sticking an E for estimated income at the end of some of those budget lines, right? Which allows them to adjust. If they get more money in, they can spend more money. But because we've spent the last several years getting rid of all those E's, that forces the legislature to come back. Did I characterize that correctly?
I'm gonna defer to Amy on this one.
Okay.
Yeah, it's really obscure, but the E's are something that traditionally were included in the budget so that we could draw in more federal funds than what was originally anticipated. So The legislature has moved away from the E's. Many of them are not familiar with that concept. So what they did yesterday in the hearing is they had originally, the governor had recommended some E's to be added. What they did yesterday, they're calling a belt and suspenders approach, where they actually, it kind of in place of the E's, put in a lot of federal funds in a lot of different places into the budget. Many of those funds, I mean, it's sort of double counting. If the funding comes in and it's got flexibility, it can go here. And if the funding comes in and it's not flexible, then it goes here. So it sort of double counted some of those dollars. You know, it adds, at least it gives some flexibility then for the administration to, you know, switch strategies.
Okay, so there's flexibility because they've put in the numbers in several places just in case they can kind of move them around, which might mean that if you're just looking at the numbers cold, you might get a little confused about how much money there actually is.
Yes, because right now it looks like it's more than 5 billion. I think it was something like 5.5 billion maybe, but we're not getting that much.
Okay. All
Not
right.
yet anyway.
All right. Very good. So thank you. We're going to jump over to the kind of practice side in terms of what we're seeing on the front lines out there. And since we were just talking economy and numbers, Marty, maybe we'll start with you if you want to go ahead and unmute yourself. If you can give us a sense, I know the Department of Workforce Development operates 30 plus workforce centers around the entire state. How are those operating, and what are you seeing on the front lines right now?
Thanks, Wally. Thanks for the opportunity to talk about you know, our efforts. What we're doing across our network of over 30 job centers is we've converted all of those as of March 13th to operate virtually. So what that basically means is public cannot access those centers, obviously, because in order to protect our staff and the public, we followed a lot of the local orders, and recently the statewide order was issued. But what we have is we have staff working behind closed doors, about 250 staff collectively, and they're averaging about 5,000 calls a day that they're responding to help support Missourians, to do everything really from filing their UI claims to getting assistance with applications for employment. We actually have quite a few jobs available right now. We have employers that are still struggling to fill some jobs. Some of these quote unquote essential services, you know, everything from a grocery store to a convenience store to logistics and transportation, and lots and lots and lots of IT work right now as everyone is moving their teams remotely. There's a big strain on those virtual services. There's a lot of back support that is needed from managed services firms. And so we're seeing a lot of hiring there. So we're able to assist those Missourians, as well as interpreting and disseminating the CARES Act. The CARES Act is unprecedented expansion of benefits to Missourians, and what we see is a little bit of complexity with that. Just like with the budget, you know, the state has to be able to receive these federal funds. Well, the federal government has to give us the guidance on how to use those funds. Just Sunday, we received a little bit of guidance of how the CARES Act might be implemented. Now, this is interesting because many of you who watch the news may say, well, it was already passed 2 weeks ago by Congress, and, you know, where are my checks and where's my supports? I needed it yesterday. We totally get that. Every Missourian we talk to is in, you know, again, crisis mode, and we're trying to respond to that. But the reality is it takes time for the layers of bureaucracy to move. And what we see is as we work to receive those funds and guidance on how to use those funds from the federal government to interpret the CARES Act so that we can implement it legally, it takes time. And so we're in the process of doing that now, negotiating with the federal government how to get that money to Missourians as quickly as possible. I will say we've made some good inroads this week, and we are able now to accept filing for individuals who we never were able to before. Self-employed individuals now qualify under the CARES Act. We have individuals who are part-time or what we call part of the gig economy. They now will qualify under the CARES Act. We have individuals who are temporary laid off and may receive callback notices within 20 weeks who now will be qualified for up to 39 weeks. So there's a lot of great benefit coming to Missourians. It's just the process of getting it there. And so logistically that takes time. And again, as Amy and Alex stated, we're subject to the budget. So we need the legislature to come in and increase our spending authority so we can receive that federal money. It's a technical term, but it's extremely important because we can't receive those dollars if our budget doesn't have the capacity to receive those dollars. So there's a legal exercise that has to occur for us to accept that money and then pass that money out to Missourians. But it's interesting because what we do is our role is really to help Missourians access training programs and access employment and help with life stabilization and sustainability. And so that means through us, you can access SNAP and TANF programs, you can access job training programs, and you can access UI programs. We're not the unemployment office that operates through the Department of Labor and Industrial Relations. They're taking over 105,000 calls a day. Over 240,000 Missourians are now on some sort of UI benefit program or have applied for a UI benefit program. We know that number is going to go up now with the CARES Act expansion. What we're doing is we're actually providing more of that one-on-one concierge service, and we're serving a number of those Missourians person to person through our job centers. And so our staff's working super hard to continue to maintain operations while also moving to work remotely. So we phased in about 65% of our staff now is working remotely. By next Wednesday, our goal is to have 95% of our staff working remotely, and that creates another set of logistical challenges to maintain serving all these Missourians while keeping our staff safe. But our priorities really have to be balanced on those two.
So let me get this right. You're exercising a brand new way of running your offices. You're implementing brand new programs. You're bringing in whole new sets of eligible people, and your volume has gone through the roof all at the same time?
That is correct.
Okay, all right. Well, thank you for the work you're doing. And let's go ahead and move over to the healthcare side of the aisle there with Dr. Kendra Holmes, the Chief Operating Officer for Affinia, who operate community clinics or community healthcare centers around St. Louis and serve a very large percentage of those folks that are uninsured, underinsured, some of the most vulnerable populations in the region. Can you tell us a little bit about what's happening at the community health centers and also about those COVID testing sites that you all are putting out?
Absolutely. Thanks, Wally. So unlike a lot of the hospitals, we are seeing a decrease in our volume for our chronically ill patients. The hospitals are seeing an increase in the hospitalization for individuals with COVID-19. We're seeing an increase in our acutely ill patients who have the respiratory symptoms as well, but we've seen a significant decrease, and this is all community health centers in Missouri, have seen up to a 70% decrease in our volume. That hurts us very much so financially. Community health centers are the safety net for, as you mentioned, underserved populations in St. Louis City and Missouri in general. So that financial burden we're definitely feeling. I can definitely share we're feeling that, but we're also seeing that our patients are suffering because those individuals aren't able to access care for their chronic illnesses, and these are individuals who have the highest prevalence of health disparities and chronic illnesses. And unfortunately, when we look at COVID-19, those individuals who have hypertension, diabetes, respiratory issues are the ones that have increased complications to COVID-19. So definitely a population that is vulnerable and need of healthcare services. And unfortunately, that was prior to, you mentioned the now 2 COVID-19 testing stations in North St. Louis City. We opened ours last week. A tremendous response from the community. You mentioned the phone lines. We're probably having about 100 calls an hour for individuals who were screening by phone. The process is that individuals who feel they may have symptoms of COVID-19 or haven't been in contact, the CDC has really relaxed some of the criteria for testing. So that's allowing a lot of more individuals to be tested, specific emphasis on first responders and healthcare workers as well. And those are the screening hotlines. So the process is that individuals who, again, may be symptomatic or meet the criteria call these specific phone numbers, and our nurses assess their symptoms. If they meet the criteria, then we schedule them for an appointment at one of our drive-through locations. So Affinia Healthcare currently has one location at 1717 Biddle. That's just north of downtown St. Louis. Carrie STL has one on Martin Luther King, and I believe they're opening one on Thursday in Whittier, on Whittier Street. So definitely increased testing in North St. Louis. A little late, in my opinion, if we're really looking at the individuals who are at increased risk for COVID-19 and increased risk for morbidity and fatalities. We've already seen that in the St. Louis area. Over 50% of the individuals who have tested positive were from North St. Louis communities. So if we were really thinking about where the need was initially, North St. Louis City, North St. Louis County should have been the first sites for testing. But unfortunately, we are here and we are definitely trying to increase the access in those underserved areas.
Thank you. And one quick follow-up question. What kind of advice would you give your regular patients that are out there wondering, is my current condition, non-COVID related, whatever healthcare conditions they need, is it worth it to come into the community healthcare clinic? Like, what are the kind of things that you think it would be best for them to go ahead and come in for? And what are the kind of things that, given social distancing rules, we should go ahead and put off?
So we're doing a lot of telemedicine, and that has significantly helped with not getting those. We're trying to avoid, if we can, individuals over 60, the elderly, those individuals who have chronic illnesses where their immune system is diminished. We're trying to not have them in the health centers. For our dental procedures, we've stopped all elective surgeries or procedures. So it's really only for urgent situations that we're seeing people. But there's a lot of assessment over the phone. So again, if you talk about the number of phone calls that we're receiving on a daily basis, is absolutely through the roof. It's because, hypertension, diabetes, substance abuse does not stop just because of COVID-19. These individuals still have these issues and still need care, specifically just related to our substance abuse treatment and our MAT program. We're still seeing those patients because we want to, prevent overdoses. So again, we're trying to really prioritize who comes into the health centers, but unfortunately for some, we do have to see them, and we're taking every precaution to make it safe for our patients and for our staff that do need to come into the health centers.
Okay, thank you. So I'm going to ask our panelists a few follow-up questions. While I do that, I'm going to go ahead and invite our attendees at the bottom of your Zoom screen. There's a little menu and it's got a Q&A. If you have questions for our panelists, go ahead and put them up there, and I'll be pulling from that to send questions to our panelists here toward the end of the hour. But I would like to go ahead and follow up and ask maybe a kind of combined question. One of the big things that we're seeing right now is we're seeing this influx of federal dollars, and we have legal hoops that we have to jump through, administrative hoops we have to jump through. But once we do that, given what we're seeing in practice, given the policy pieces that we're seeing, what should the top priorities for spending those federal dollars be? If you were kind of sitting, if you had the ear of somebody who was making those decisions, what kind of things would you be pointing them toward? And I'll open this up to anybody on the panel, and don't forget to unmute yourself if you want to go ahead and answer. Who wants to give a shot at taking the first bite out of that elephant?
I'll go.
Okay.
Definitely thinking about the frontline workers and the population that we serve. Increasing Medicaid access to individuals would be very helpful for our population. We're treating a lot of individuals who are uninsured. If these individuals had access to health care prior to this crisis, it could help prevent a lot of comorbidities and death. So I would definitely focus on Medicaid expansion and making Medicaid available, and just the Medicaid system in general. We see so many individuals who come off the Medicaid rolls who are eligible and have been taken off of Medicaid. So funds to really make that process more efficient and to provide Medicaid for individuals who need it would definitely be a priority for us.
Absolutely agree with Dr. Holmes, and I think following up more into my sphere on the economic side, what we see is life stabilization funds. And so we need to make sure, if we think about Maslow's pyramid, right, it's the basic needs we have to respond to first. And then you can't have self-actualization if you haven't supported the lower level needs. So, health and wellness is extremely important, but we have individuals that we serve every day that have food insecurity. So making sure that these individuals have access to resources, whether it's SNAP or TANF benefits, or even access to support our local food pantries so we can make those connections. We have homelessness issues. We have individuals who every day are calling us to get help with unemployment claims or to get other help, who are calling us from their cars, which they're actually living in the moment. And so dealing with those life stabilization efforts. So we call that the triage. So helping individuals where they are with the needs they have right now. So that's step one. We see that on the front lines of getting those benefits expanded as the CARES Act does allow more benefit for more individuals, making more connection to SNAP and TANF programs, certainly access to expanded Medicaid programs. But then really our focus has to pivot quickly in the next 4 to 6 weeks for us. We think about what happens when those UI benefits run out in 20 weeks and then 39 weeks. One of the challenges is any individual who's on UI right now currently before the CARES Act was passed, their benefits are going to expire within 20 weeks. And so they won't qualify necessarily for the CARES Act unless their situation changes. So we have individuals before July 31st, whenever the CARES Act expires, it's going to have a bit of a cliff. And then certainly there's going to be a huge cliff on July 31st when these benefits do expire that have been passed from the CARES Act. So we're already thinking today, what do we need to do to help with sustainability efforts as it relates to employment and training for those individuals when that time comes?
Mm-hmm.
Anybody else want to add there?
Yeah, I would echo what some of Dr. Holmes was saying in terms of both Medicaid coverage, which we know there is some changes in eligibility happening right now during this emergency period. I think one thing is that a lot of people that would be eligible or would qualify for that don't realize that this is a benefit in place for them. Now, granted, there are criteria for getting Medicaid eligibility, but I think, there needs to be a better job of communicating that, hey, you have extended SNAP or food stamp benefits, you have extended Medicaid benefits if you do have COVID-19. So I think there are ways that we can communicate that better. I just want to kind of reiterate some of the remarks that were made earlier too, in terms of the frontline workers, not just the healthcare workforce and the safety net workforce that is propping up things like testing sites when no one else is propping them up. But local public health agencies, they have really been one of the first entities to really respond and have to kind of authorize and deal with some of the orders at a county level especially. And so, they've had to put out different, different resources that really, let's be real, they are underinvested significantly and don't have resources. So these public health, social service, safety net, and healthcare providers need to receive and have the ability to receive some of this funding to almost reimburse them for what they've already put out thus far.
So what I'm hearing is, is a big focus on making sure that money flows right down to people, as opposed to maybe those kind of big block budget pieces that the legislature might be tempted to look at. Amy, did you have something you wanted to add there?
No, I think I agree with what everybody has said. And what this points out to me too, this discussion, is two things. We've got our urgent needs where we desperately need to respond to the healthcare and the economic needs of our families in Missouri, right? We need to do that quickly. We need to get those benefits moving and people signed up for things like Medicaid and more funding into public health. But we also need to think about next time. This is not the only crisis we're ever going to face. And this could go on for a while. So if we had in Missouri, a safety net structure that was robust, we would have been better equipped to respond to this quickly and help families get through the crisis. I think For me, that's one of the most critical things that needs to happen through this process. So let's take care of our urgent stuff, but then not stop. It's also going to be incredibly important for us to keep going.
And a deep theme that I wanted to bring up here, of course, is the disparate outcomes based on race that we're seeing both around the nation and in the city. And I feel like we're talking about that already, right? Because we're talking about those folks that need it at the bottom. But if we think about that, what else do we need to be thinking about to address the fact that we have folks that are already starting from way behind the start line when it comes to healthcare access, and now they're getting hit with this tidal wave of a healthcare crisis? Long-term, expanding Medicaid, expanding that safety net, but short-term, what are the things maybe that we can do to try to ameliorate that disparate impact right now?
Well, I think it's hard. That's the hardest question out there, right?
Yeah.
I think that one of the things that Dr. Holmes said is, we need to be looking at increased investments in the areas of our state that are going to be hardest hit. Among the populations that have those significant pre-existing conditions that make them most at risk right now. And among those pre-existing conditions, I would say, is poverty, right? So really investing deeply in those communities that are the poorest in our state. So parts of St. Louis, parts of the Boot Hill, and so forth. Like it's not about distributing money equally right now. It should be about some places need more. And that's okay.
Okay. I think that's a powerful point because we often think that if we distribute the money equally, we're being equal, but we're not, because some places are starting from way behind. They're way behind that starting line, and an equal amount of money does not give them an equal outcome. Absolutely.
Absolutely. Yep.
Yeah. So I'm getting questions from our audience, and I'm going to kind of combine two questions here because I think they're interesting. Can we talk about the types of administrative changes that need to occur to facilitate utilization of the CARES Act funding? And maybe a piece of that also is the tele-access to everything, telemedicine, tele-application for unemployment insurance. What are those changes that we need to see administratively, and maybe building out that online piece of access for people?
So in terms of some of the administrative changes, there have been, I think, hundreds of both waivers to statutes and changes of regulations at the state level. And many of them have been extremely helpful, going to things like Medicaid, to food stamps, to childcare assistance. One thing we haven't seen a change on is temporary assistance for needy families, if I'm not mistaken. And I think that goes again to the kind of the hierarchy of needs. And so if we're going to also adjust some of these other benefit programs, we need to think about adjusting that as well. One thing I think that we need to also consider is that a lot of these waivers that have been put in place of regulations or of statutes were done so, a few weeks ago, thinking about that timeline that existed a few weeks ago. And so we're now in April. And we need to really think about what is the timeline in the short term, let alone the long term for some of this. So the immediate timeline in terms of the declaration of the emergency status. Okay, so we need to adjust those waivers in that way. But then, one thing that I've mentioned before, and I know a lot of groups are working on, is identifying those things that shouldn't just go away because the emergency goes away. Where the declaration goes away. There are changes that I think should remain throughout just normal practice, because it's what's best for communities, for people, and how they can lead their best lives. So I think there are several groups working on identifying those different administrative changes that we'd all like to see in place for the enduring period of time.
If these changes keep people healthier during a crisis, let's look about keeping them healthier kind of on an ongoing basis. Absolutely. Anybody else want to weigh in on, I know, Kendra, that you said you've been doing a lot of telemedicine, and it sounds like some of those regulations around that have been loosened up a little bit.
They definitely have loosened up, and that's been helpful for a significant amount of our population. But I do want to bring up that the population that we serve often don't have access to technology. Just thinking about the schools with children being out of schools, and so many children who didn't have access to tablets, who weren't able to keep up because they don't have that access. So that's telehealth, and you know, using technology is great, and we need to focus on that. But we also need to understand that everyone does not have equitable access to those media.
Absolutely, and that actually keys right into another question we have from our audience. How can the state assist individuals who are not technically savvy and can't apply electronically? How much of a delay do you anticipate if paper applications increase? And Mardy, that night, when we think about paper applications, I'm guessing they're talking about kind of unemployment and things like that, although they could be talking about Medicaid as well. Is there are you seeing an uptick in the paper versions as well?
You know, we're seeing, yes, we are, because we're seeing the system, as it absorbs hundreds of thousands of calls a day. Unfortunately, there are a number of Missourians who aren't able to get through or being served as quickly as we would like, and certainly not as quickly as they need to be served. And so we've stood up a few different alternatives. One is, again, using our job centers, which normally don't file UI claims. We've now filed almost 40,000 UI claims for Missourians who otherwise wouldn't have access to that kind of one-on-one service. We're able to do that virtually, 100% virtually. So we're working with individuals who don't have access to the internet, that can't go in and log in and file their own claim, and we're over the phone doing that, or using FaceTime or Zoom or other ways to do that. Of course, we're dealing with some sensitive information, so we have to be careful at the same time to protect that information. The other thing that we're doing is, outside of all of our job centers, we created drop boxes where individuals can drop their paperwork off if they have to use a paper application, and then staff is retrieving that on a regular basis throughout the day. Again, we're trying to limit the transfer of germs and other things. We know paper can be a conductor, but the reality is we have to help people the best we can, and there is a measure of risk with that. So we're accepting documents in paper and processing them on behalf of Missourians electronically. But you know, serious infrastructure issues are a challenge that, as Alex said, long term, not only do we got to address some of the policy items, we got to address some of our infrastructure challenges. And the fact that Missourians, especially in our rural parts of the state, do not have access to broadband. We're seeing that issue as our schools have closed and students have been sent home, and as individuals are trying to access different services across the state, they're unable to because they just simply don't have access. And so those are real challenges that we need to continue to prioritize and resolve across the state.
Okay, thank you. Yeah, the digital divide, and I've got a question here. I think we've kind of addressed that about how we talk about address the digital divide, because that's big. But let me understand correctly, Mardy. So what you're saying is folks that don't have access to online directly, they can either drop off a paper application or they can call you, and essentially your folks will sit in an office and transfer that into the electronic database or system that you're using.
That is correct. Yep.
Okay, great.
One-on-one filing services for Missourians the best we can.
That's really good information to have. Thank you. So I've got a question here. Considering the secondary and tertiary impacts of this pandemic and implications for localized human service systems, in parentheses, a long-term recession is likely to drive a jump in suicide and psychiatric need. Is there a novel funding apparatus for behavioral health service lines? I think that's a really important question, because behavioral health is something that was difficult to access before this even started, and scarce. Are there pieces in place to try to beef up that part of the healthcare system as well?
I believe that some of the supplemental budget also includes funding for the Department of Mental Health I'm not 100% sure what all that includes, but I know that there was some funding from some of the congressional packages too to prop up those services, as well as some administrative changes to allow for, you know, teletherapy and things like that. One of the things that Missouri Foundation for Health identified was the same needs that Dr. Holmes had talked about with health centers in particular. Those also exist with community mental health centers. And so we've tried to provide some kind of short-term support while those health centers wait for federal opportunity. And it's certainly not enough. And there are going to be additional supports and resources that are needed for those providers to continue to serve people in that way. But we hope that, you know, in the very immediate short term, that can help them a little bit.
Mm-hmm. Yeah, and there was, just piggybacking on what Alex said, there was some funding that was included in the supplemental budget. And again, you know, none of it's enough. You know, I think that one of the things that the Congress is already doing is already discussing a fourth bill. You know, they've passed 3, and this will be their fourth bill that looks at longer term supports and things like fiscal assistance to the states to be able to provide these services will be critical. There needs to be a much more significant investment in the next bill. But they're also looking at extending some of the good things that they did, like rebates for families, you know, the tax rebates for families, as well as some of the unemployment provisions and different provisions related to the safety net. I think, you know, right now everything's on the table.
Good. It should be. Excellent. Yeah.
Just one little thing that I would share around that. In the past couple of weeks especially, you see a lot of the language changing too, from not just social distancing, but like physical distancing, hoping that people understand that, like, you're physically distancing yourself to protect yourself, but you can still be socially engaged in some way, shape, or form. And I think some of that change in messaging, particularly from the public health and healthcare sectors, was to try and alleviate some of those concerns around the social disconnect.
Mm-hmm. And actually, I'm sorry, related to that, that's really important. And I think it sparked a memory for me, the child welfare. Right, another piece of this puzzle is child welfare, and it's significant. You know, we are going to have grandparents, for instance, who are caring for grandchildren who become sick, and those grandchildren are going to need to be placed somewhere. You know, we're going to need a more robust foster care structure, and unfortunately, it's going to be harder for us to find foster care. Because families are reluctant to take new folks into their homes right now. So, yeah, that's something that it's going to need a significant, child welfare is something that's going to need a significant investment too. In helping families, you know, through this struggle as they face increased stress is going to be critically important.
Yeah, that's a really important point, because while they can catch the virus, it tends to have a lower impact on children. They seem to be kind of an invisible entity in this crisis, and we have to realize it's their caregivers, it's their family, it's their support networks that are being hit, so they're being hit as well. So yeah, thank you for bringing that up. That's an important point. Does anybody else want to add anything on that front?
I'll just add, as far as the need for mental health services, you know, so many people are in crisis. We are, just for our phone calls, the number of individuals who are just really wanting to talk because they're so anxious about what's going on. So the need for mental health has never been greater with what's going on with COVID-19.
Yeah, and as I understand it, as folks are kind of locked in their homes, right, it's higher risk for substance abuse, right, as a coping mechanism, higher risk for domestic violence. There's just a lot of things that are kind of being brought to a boiling point in terms of family care that we really need to be thinking about. Yes, good. Another question here, with the most vulnerable population relying on public transportation, what would happen if the system shuts down? Currently in St. Louis, the public transportation system is operating on a weekend schedule 7 days a week. This is impacting employees who still have a job but can't arrive on time. I think Kendra and Mardy, since you all are dealing with the folks that are either coming to get health care or coming to get a job, what are you hearing on the transportation front at the moment in terms of other needs being met? What do we need to think about?
So transportation has always been a barrier, and especially augmented now with COVID-19. But we have a large population of homeless patients as well. So that's part of the reason why we wanted to implement not just the drive-through COVID testing station, but walk-up, because some individuals don't have access to automobiles. So we made that process really something that was a priority for those individuals that are using public transportation. And as far as employees, because a lot of our employees also utilize public transportation, we're really trying to work with individuals who may not have, reliable transportation. And I think that's something that all organizations need to look at, that, it's not just the patients that are impacted, it's also your employees. They're dealing with the same things that our patients are dealing with, and to have policies and procedures in place to also accommodate your staff.
That's a good point.
Absolutely agree with that. And the only thing I would add is going back again, the infrastructure piece. One thing that we're learning is we've done rapid deployment of increasing the capacity of our staff to work from home, and so that means laptops, hotspots, helping individuals who work for us who don't have internet to get access to internet at home, and just rethinking what that relationship with the employee looks like, to support that employee where they are and where they need to be. And that, it's just like our approach to helping customers of trying to bring our services to them the best we can. Of course, that means virtually right now. And, those barriers of transportation are no different than having, a barrier to access to internet or anything else. We got to find ways to serve our customers and our staff and allow them to have the capacity to achieve what they need to achieve, regardless of if the buses are running or if the internet is accessible.
So those with the greatest need are once again faced with the greatest barriers to access, be it virtually, be it in person via transportation, be it simply in terms of having a household with role models for how to access healthcare, how to get into the system, and how to do all of that. Absolutely. And I want to, as we're getting here toward the end, I want to make sure that we give a shout out. We've mentioned those frontline folks a little bit, right? But we're thinking about the healthcare employees. We're thinking about grocery store workers. We're thinking about the Amazon delivery guys driving around and showing up at our front door. And want to make sure that we give them a shout out in terms of the amazing work that they're doing. One of the things that we could do in this state is classify, say, grocery store workers, and a variety of other folks that we normally think of as kind of replaceable workforce, classify them as emergency responders, which would give them access to a whole new set of state benefits. Am I right about that?
Yes.
Okay. So that's something we'd like to see?
That's something I would definitely like to see, and I'm a pharmacist by trade, and pharmacy technicians are not included in that first responder classification. And again, COVID-19 does not stop a person's need for hypertension medications, blood pressure medicines,
cancer. And they increase it.
Yeah. So, I'm definitely, probably a little bit biased because I am a pharmacist, but pharmacy workers absolutely are essential and should have that classification.
All right, I'm going to round it up with one last question, which is cities and states right now are becoming labs and real-world experiments for responses, right? Because we're seeing one state institute these policies with these outcomes, one city institute these policies with different outcomes. that is both incredibly interesting for public health studies for the future and incredibly tragic when we talk about the things that could be done that aren't being done. So can I ask all of you to just give us some thoughts on, in terms of our region, the St. Louis region, and think about it as the metropolitan statistical area, right? So I want to include East St. Louis. We want to include those outlying counties. Where do we rate in terms of our coordinated response to this right now? And Marty, as a public employee, I'm going to go ahead and absolve you from having to answer this one. But if you would give us a sense, where is our response ranked, and what are the things maybe we should be doing? Are there some things that we're ahead of the game on?
I can start this one. So I think that, you saw the St. Louis region stepping up pretty quickly with responding, because there wasn't, the same kind of level of guidance at the state level. So St. Louis, Kansas City, Greene County, those counties really did step up. I think initially what we saw was, differences between city and county and the divides that are always there. But I will say that, I think the region sort of picked up a little bit quicker than normal in terms of trying to get on the same page and have the same basic guidelines and orders in place. And I think when they started to do that more and kind of sing in unison, it was a lot easier, because we know that people don't just live and exist in one county. They move around, though they shouldn't be as much right now. But, when the region started to do things together and have joint press conferences, drop orders around the same time with the same language, I think that was really helpful. I think the response from the big health systems has been helpful in terms of the pandemic response team. I think that might be what it's called, the St. Louis region pandemic response team. I think it's good that those systems are talking to each other and trying to figure out some of the needs and the resources so that they can communicate with SEMA and with the, DHSS to figure out what it is that they need. I think we're a region that tends to be split, so it's going to take time for us to do this really, really effectively and really strong. But I think, they have been doing a decent job. I think there are a lot of private entities. So one of the groups that I know is working really hard is a group led by Dr. Jason Purnell to really identify the social service needs and the community needs with a racial equity lens. And so what we don't want happening is what happened during Ferguson and after Ferguson, when everyone was doing separate things. And it was just divided. So I think they are trying to learn from those situations. And as a region, we're trying to respond a little bit more effectively than that.
So I know Dr. Purnell is the head of the county coordinated response team, and it sounds like he's trying to kind of imagine that as a more regional piece. And the city has Dr. Alex Garza, I believe, at the head of its pandemic response team. You mentioned a regional team, Alex. Is there another team, or is it just kind of these ones working together?
I think that at least Dr. Purnell's group, he is trying to look at kind of a regional approach. And although he's tapped by the county to kind of provide his expertise, he's working not just by county, he's working regionally. And the pandemic task force is a combination of the health systems, I believe, working together. So representing BJC, SSM, and Mercy and St. Luke's.
Yeah, we haven't even touched on the hospital systems and all of that. Wow, yeah, okay. Anybody else want to weigh in on the St. Louis regional response?
So I'll focus on the positive. I'll just leave it at that. I'll focus on the positive. And Dr. Frederick Eccles, the Director of Health for the city, has been absolutely amazing. He has reached out to the community health centers to really, again, try to assure that the underserved populations do have a voice and are being tested and treated. So again, I would give them an A for their effort thus far. I would point to the Missouri Foundation for Health. I think they're A+, Regional Health Commission. Those particular organizations, I think, were very fast to react, to know what the needs are. And I think that their response has been phenomenal.
Fantastic. I'm very glad to hear it. All right, and let's see. Good. Okay, I think that at this point, I don't see any other questions from the audience, and we are just about at time. So I'm going to go ahead and start wrapping it up. I really want to thank all of you, Alex, Kendra, Amy, Mardy, for joining us and spending your valuable time with us this morning. And we've got this recorded as well so that we can keep pushing this out, although by next week this will probably be outdated and we'll have to do it again. You're all in my Rolodex, so maybe we'll bring you back, but I thank you so much for spending the time this morning, and thanks to all of our attendees for joining us. This is Wally Seward from Focus St. Louis signing out.
Thank you.
Thank you all.